Good afternoon, everyone. It's actually a privilege to be here. It's a privilege because I think we have a really incredible opportunity for me as well as you to hear about the remarkable things that are being performed by my colleagues, particularly in patient care in general as well as in transfusion-free medicine. My expertise is in breast oncology. I'm a breast surgeon. That's what I do. It's the only thing I do. So I can't say that I have your back today, but perhaps I'll have your front. So I'm an optimist. And when you think of breast cancer, you often see incidence rates of about 1 out of 8, that 1 out of 8 women will be diagnosed with breast cancer, which I agree is one woman too many. But I also look at that and I think that's actually only 1 woman out of 8 because many women perceive that their risk of breast cancer is high. And when you hear about breast cancer today, you feel that it's really very common. It is common, but fortunately, it's not as common as we may think, only 1 out of 8. But even more importantly, we think of breast cancer and often you think of the consequence of breast cancer, the possibility of death. But I like to recognize and acknowledge that only 1 out of 36 women will die of breast cancer. That's because of the advancements in treatment. More importantly, it's about early diagnosis. But this gives me a reason for hope and not a reason to feel dread. But those numbers are not numbers of chance. It really is a matter of the importance of early detection, and that's really why I wanted to start off with these few slides. That we have screening protocols, we have recommendations for annual screening and so forth for women age 40 and older. I know that's been debated over the last few years, but most of us still believe that mammograms beginning at the age of 40 for the average Swiss woman is most important. And it's really through the means of early detection that we're able to diagnose breast cancer early, to obtain great long-term outcomes, and offer treatments that are less extensive, less burdensome, and have the lowest potential for blood loss. I got this slide from a colleague about 10 years ago, and it's really sort of my driving force or mission to think about when I think of what I can offer a patient with breast cancer. This is the outcomes of women diagnosed with breast cancer that's the size of a dime or smaller, about 14 millimeters. 25-year survival, better than 90%. It tells me that most women diagnosed with breast cancer today, with early diagnosis, screen-detected diagnosis made by mammography, perhaps by MRI, are likely will likely be here in 25 years unaffected by their cancer diagnosis, unaffected by that diagnosis specifically, but perhaps affected by the treatments that we gave to her to treat the breast cancer. So when I think of breast cancer, I approach it with this philosophy that most women will be long-term survivors. As a cancer expert, my mission, the career mission, has been to participate in the development of treatment approaches, both surgical and radiation approaches, that minimize the short and long-term impact of breast cancer care. And that includes minimizing pain and blood loss at the time of surgery, but ultimately that preserve the long-term survivorship, the health and well-being of a woman who's been diagnosed, because I expect that she'll be around in 25 years to tell about her story. So I'd like to share with you just 4 approaches that I've been involved with, both from the research perspective, but also as a care provider. I call these minimal impact approaches as opposed to minimal invasive approaches, because minimal invasion to me means that I'm doing less extensive surgery, which is good, but what I'm more interested in is in the global impact of the treatment on the patient. Not only short-term things like blood loss, but long-term disability or consequences of the treatment, the cosmetic outcome, which is an impact of surgery. So I think of it as a much more broad term than simply what I'm performing surgery. I'm thinking of what I'm going to deliver as a lifelong consequence of having the cancer diagnosis and treatment. So we're going to talk about some approaches to breast cancer surgery, lymph node surgery, intraoperative radiotherapy, and cryoablation.